We have an exciting roster of speakers this afternoon to kick this off, and I have the pleasure of introducing these speakers. And we're going to introduce them one by one. They will be coming up on stage, but I think what you'll find is that they all share a desire to instill hope into the future, and I know that's why we're here. To begin with, the first speaker, it's my pleasure to introduce a collaborator, a community leader, a friend, and a partner of the Royal who has cared not only for the physical health of our community during the pandemic, but to the effects of the pandemic on our mental health and substance use health. She hails from Hazelton, BC, having obtained her medical credentials at Simon Fraser University. She has been with Ottawa Public Health for more than a decade and continues her role as an educator at the University of Ottawa, where she continues to supervise medical residents in public health and preventative and family medicine. And I would say that she is also helping to educate all of us and our entire community. Please join me in welcoming Dr. Vera Etches. S'il vous plaît, accueillir l'incroyable Dr. Etches.
Bonjour, Quay. It's so nice to see you today, and it's not just because we're back in the dark days of not leaving our homes. My goodness, there have been some hard times, and so it's so nice to be able to be here today to celebrate. I feel very honored to be here with people with lived and living experience, and friends and families, service providers, there's allies, community partners. We're all here to celebrate the achievements of people on their recovery journey. En attendant ici et en participant à l'événement aujourd'hui, chacun d'entre vous contribue à réduire la stigmatisation dans notre communauté et à accroître le bien-être des personnes qui consomment des substances. So it is true, you know, in Ottawa, we continue to see and we experience the real threats and harms of our increasingly toxic drug supply. And we have the ongoing stigma that surrounds just the topic of substance use and people who use substances. So this stigma does need to end. Cette stigmatisation doit cesser et vous êtes une grande partie de la solution. So Recovery Day Ottawa is important. Every year, we need to celebrate and raise awareness that recovery and wellness is possible. So we remain committed to working together, guided by, led by people with lived and living experience and our many community partners. We know we need to increase services and supports that are available. They need to be provided accessibly without judgment. Nous avons encore beaucoup de travail à faire dans cet espace, mais nous allons absolument dans une bonne direction. We just heard Joanne's words about the direction we're heading in, where you don't have a separation between mental health and substance use health, and I am hopeful for the future. We work closely as Ottawa Public Health, the organization I'm with CAPSA, and with the Royal, with the Canadian Centre on Substance Use, and we have a community action plan. It's about promoting well-being, and I want to thank Gord especially for making sure we're shifting this. It's not just about health, it's about well-being more broadly. So thank you, Gord. In this community action plan, there are 3 areas of work, and the first is what you're helping with. It's reducing stigma related to substance use. The second focus is that we're increasing access and availability to harm reduction services. So again, being able to meet people where they're at, rather than expecting, that everyone's going to be able to completely stop using substances. We also are working with partners to create a centralized and simplified way to access mental health and substance use and social services support together. So that's the third area of focus, is this integrated service. Myself, all of us at Public Health, we're continuing to grow our understanding of how stigma impacts people with living use, And we know that part of what we need to do is promote the person-first language. So, nous continuons d'en apprendre beaucoup de nos partenaires, y compris l'importance de la compassion et d'accorder l'importance à la personne. So our goal is that through these interactions, as we keep learning together, we're going to have more and more people in Ottawa that communicate about substance use in a way that can help everyone feel supported without adding to the harms that happen sometimes when we simply discuss substance use. And I want to say another reason for hope that I have is that this week I was privileged to participate in a 2-day dialogue about drug policy in Ottawa. This was part of Getting to Tomorrow, Ending the Overdose Crisis. It's a National Health Canada funded initiative, and it's aimed at hearing from communities, bringing different partners and people with lived and living experience together to surface solutions to the overdose crisis. And so there were, again, many people involved, people who use drugs, people in recovery, youth, family members, health professionals, people from all levels of government, the police, First Nations, Inuit, Métis organizations, faith leaders. And this gives me hope because people had at the common interface a real desire to move forward in a place of compassion and empathy and with a human rights framework. J'ai hâte de poursuivre cette conversation et d'aller de l'avant avec les actions que nous avons entendues être une priorité pour améliorer la santé et le bien-être des résidents d'Ottawa en ce qui concerne la consommation de substances. So I just feel so privileged to be able to be here on behalf of Ottawa Public Health as an ally for all this good work that is happening and our commitment to continue to advance more solutions with you. Mon équipe de santé publique Ottawa et moi-même sommes déterminés à être des alliés de la réadaptation. You can feel the change that's coming. Thank you. Merci.
Merci beaucoup, Dr. Etches. Thank you for sharing your thoughts. As what I will say on behalf of everyone, that we recognize you as our medical officer of health, and we're very proud of you. Yes, let's give Vera a hand, definitely. Because not only does she help us in light of the pandemic, but she is recognizing and advancing that substance use health is something that we need to address collectively as partners to support the well-being of all our citizens in the community.